Hey everyone, good evening. Thank you all for being here tonight. My name's Steve Adelsheim. I'm a child psychiatrist in the Stanford Department of Psychiatry and Behavioral Sciences, and I'm also lucky enough to be the director of our Center for Youth Mental Health and Wellbeing. And tonight, we want to thank you all for coming out for this presentation, really focused on early intervention and youth mental health. And we'll be hearing tonight actually from most of the members of our center, as well as some of the young people who are working with our youth advisory group on one of our programs. So what I want to do initially is ask the members of the people of our team that are sitting up here in front to just quickly introduce themselves, and they'll tell you just briefly what they're going to be speaking about. I'm going to make some introductory comments, and then we're going to hear from our panelists. I would ask if you think you might want to ask us some questions at some point during the evening tonight, take one of the index cards, write your question down. We'll be collecting them from you from time to time, and then we'll pull the questions and answer them after we've heard briefly from our speakers. Okay? So who are you? Let's see. Here.
This one's on. Hi, my name is Phoebe Cox. I'm the program manager at the Center for Youth Mental Health and Wellbeing, and I'm going to talk a little bit about medium mental health.
Hi everyone, my name is Rochelle Ogundelli, and I'm the Supported Education and Employment Specialist with the Center, and I'm a social worker. I'll be talking today just about some of the myths that we have around students and their experiences in school.
Hi everyone, I'm Steve Suss. I'm an early career child psychiatrist. I graduated from the program here in 2016, and I wear a number of hats. I work at Stanford with the center, and then I also work in San Mateo County's Behavioral Health and Recovery Services, and then I also work at Santa Clara County's Valley Medical Center in the Psych Emergency Room. I will be talking about schools and the prevention and early intervention piece.
Hola, buenas tardes. My name is Inelia Souter. I am the Youth Outreach Specialist for the center. I apologize for my voice, and if I sneeze, I don't. And I will be talking about youth voice, lived experience, and how that connects to the awesome work that these young ladies are doing in the youth advisory group.
You want to just turn that off for a minute? Yeah. So I'm just going to give a brief overview of some of the issues related to youth mental health and why we all focus on this work and why we're so glad you're here joining us tonight to talk about it. As many of you know, when we look at really what are the primary health issues for young people between the age of 10 and 30, the major issue that young people are facing in terms of any kind of health issue are really mental health issues. For the most part, young people between 10 and 30 are really quite physically healthy, but this is also the time when we tend to see more mental health related issues develop. And in fact, one of the important things that we've come to recognize over time is in fact that half of all mental health conditions have their onset or their early symptoms beginning by the age of 14 years of age, and 3/4 of the time by the age of 24. And so really part of the issue becomes how do we have support and ways for young people to get that early care? At the same time, we know that many parents, find it very difficult to be able to access mental health support for their young people, even when they often realize that they're dealing with a mental health related issue. And in fact, we know that 20% of our young people between the ages of 12 and 18 may have a mental health issue that's a serious condition. And when young people get to the ages of 19 to 25, it goes up to actually almost 30%. At the same time, we also realize that young people are not very good at getting help. And when we think about our children moving from the pediatrician's office to what's next in terms of health care, we don't have easy access points for our young people to get care, whether it's medical care, but also then especially mental health related support. And so we also realize that young people really between the ages of maybe 15 and 25 are really not very good at accessing the mental health care that they often really need. In California, when we look at sort of mental health related issues, what we find is that 1 in 8 young people may be dealing with a depressive related issue, but even in our state that actually has more resources than many, less than 1/3 are receiving treatment. And that may be because other people don't know there's a mental health issue. The stigma issues can often make it really difficult for families to feel comfortable getting care for their young child as well. And there are also workforce issues. We often don't have enough people who are trained in child and adolescent mental health issues to be able to be easily accessible to provide the care that our young people may need. So part of the reality often is that it's really hard to find treatment. And so people talk about building access to care, but in reality, it's often very, very hard to find it. Whether someone has health insurance and they're looking at their long list of potential providers and they're calling them all to see which one is accepting new patients, or for people that are dealing with insurance through our county systems or are uninsured, sometimes the waits are very long and access isn't easy, particularly for young people. In our community here, particularly in Palo Alto, we've been dealing with, serious issues related to depression and youth suicide to the point that, we have been given national attention based on this issue. We had the Center for Disease Control here sort of studying this issue in our county in Santa Clara that really actually found that compared to other counties in California, our actual rates of youth suicide are really better than most of the counties in the state and better than the county average. At the same time, we continue to struggle with this issue at times and really still need to build additional resources for our young people, but also, frankly, for young people all over the state. This remains a huge issue. One of the things that we have been focusing on is really looking at how do we create sort of a public mental health continuum for our young people. When we think about, the notion that really if half of all our young people by the age of 14 are really starting to develop mental health issues, the question becomes, well, where are they supposed to get care? And how do we find those young people early and link them to early treatment for mental health, just like we would for asthma or diabetes or any other type of medical condition? And the fact is, in this country, we really don't have a public mental health system in place that really allows for those early services to happen. So one of the things that we've been looking at is how do we create in the community sort of this continuum of care to be able to build on those services. So as you'll be hearing from some of the folks on our team, we're working at how do we build partnerships with schools and develop expanded school mental health related supports. And the counties are looking at doing that across our state as well. And then we'll be talking briefly about some of these integrated youth mental health programs that we've been working to develop that become really one-stop shop for young people to come in and get early mental health care. And we also work with some programs around early psychosis being sort of the mental health condition where young people might start to wonder if they're hearing voices or losing touch with reality or their brain is playing tricks on them. And there's been a lot of interest nationally and internationally in developing these early intervention programs for psychosis, because the data is actually very clear that the earlier we can identify young people, even with an early psychotic illness, the better they will do 10, 15, even 20 years later. So really, we're trying to work at how do we create this early continuum of support and then be able to build out the systems that young people need. So as I mentioned, one of these integrated youth mental health programs is the Headspace Program, which is based on a model out of Australia. And in fact, Australia has 110 of these walk-in clinics for young people with these early services that are designed with a look for young people, that advertise directly for young people 12 to 25 to go in for mental health, physical health care, early addiction treatment, and other types of support in terms of school and education. And Australia, having 110 of these is half the population of California. But it's a nation that really has made a commitment to early intervention. One of our partners that we've been working closely with recently is the Foundry program out of British Columbia that's developed a similar model. And they now have 6 of these programs across British Columbia. They're going to have 11 by the end of this year. Ireland has their version of this. They have 13 jigsaw programs across Ireland. These are being built out across Ontario, in France, and United Kingdom. And we're really looking at starting the very first of these sites in the United States here in Santa Clara County, and we're very excited to be working with the county and other partners on doing that. As we've been working on and thinking about, like, what do these sites need to look like here in the United States and in this county, part of the issues that, our youth advisory group has been thinking about with us and with our partners at IDEO.org who are working with us on the design are like, what are the issues young people are facing and how do we design these places in a way that will be comfortable and meaningful for them? And I think one of the things that our IDEO partners have also learned, and I think we've learned as well from our conversations with our youth advisors, is that the young people in our communities are running around a lot and trying to keep up with everything and really, to some degree, are really struggling with how to manage all the things they're being consistently asked to do. And in terms of the design of the facilities we're looking at here, what's coming up is this notion of being able to pause and catch your breath and have a space where young people can do that, and then maybe think about what kinds of conversations young people then want to have with friends or with other concerned adults, what kinds of activities they want to do, and then again, what kind of health, mental health, and other supports do our young people need to stay healthy and on track as well. So I will stop here and turn things over to Vicki.
All right. So I was just going to take just a few minutes to talk a little bit about media and mental health, which is one of the areas that we're really interested in for a lot of reasons. And you can see from this slide that media is a broad term, so there's really 3 major categories. Steve showed a slide with that Atlantic magazine cover on it already, which some of you may have seen, that came out in 2015. But some of you may not know that there is a contagion effect to the way that suicide is reported on in the media, that there's lots of research that has backed that shows that the way that it's publicized, reported on, the types of images you show, the frequency of reporting can actually lead to copycat suicides. This happened after Robin Williams' death, Marilyn Monroe's death, and it goes back many decades before that in terms of research on it. So it's something that we're concerned about and have been looking at. Social media, I'm going to talk a little bit more about in a minute. And entertainment media, some of you probably know what show this image is from. 13 Reasons Why on Netflix was pretty problematic and got a lot of attention from mental health professionals because of the guidelines, the safe reporting guidelines that we have to minimize the contagion effect. And this seemed to violate a lot of those, so it raised a lot of concern about kind of glorifying suicide, showing a very graphic depiction of suicide. Yet it was also a very, very popular show. So there's a lot going on with regard to mental health in the media that is just worth paying attention to. And something that we did, I realized I didn't test this, but I think I wanted to show you a 5-minute video that some of our local teens produced. We had a convening about a couple months ago around mental health and suicide reporting for local news and journalists. And I'll let you just hear from them if this works. Some of you may have seen this article that came out, I think, the end of last year, December 2017, which got a lot of attention. This Have Smartphones Destroyed a Generation, some research from Jean Twenge from San Diego State, where she tracked the rise of depression and anxiety in relation to the rise of smartphone use around teens. And so it's not a causation, but there's correlation there. And so she had pointed that out, and a lot of people really paid attention to that. And some people, are skeptical of that, but it's just yet another point to the concern that is being raised around social media and mental health. So there's a lot more dialogue happening around that. And as as parents in the audience or concerned community members, I mean, there's a lot of concerns that come up with adolescents with regard to their social media use, body image issues, sexting, pornography, video game usage, bullying, self-harm. There's just a lot that people are concerned about. So it's an area that we've been looking at. But I also wanted to point out that there are some benefits to it. I think people just want to kind of put their head in the sand and say, don't use it. And that's not necessarily the right approach. It's not going away. It's a big fabric of our lives now. And so I'm going to give you some guidelines for how we would recommend handling social media with adolescents. But these are just some of the benefits that people derive from social media use. And it's really opened up a lot of opportunity for people that previously didn't have access to a lot of information, connecting with people across the world. It's encouraging a lot of self-expression. There's a lot of people, young people blogging, expressing their opinions, their interests, and it's providing leisure and connection for a lot of people. And really for adolescents, there's not a difference between their offline and online lives. It's all kind of blurred, so they're connecting with their friends both on and offline, and that's very normal and very okay if done in a healthy way. So these are just some general guidelines. And really the bottom line around this is that it's something that you should guide your children through as you would with anything, with healthy eating, with learning how to drive, it's really just something that you need to help guide them on. So familiarize yourself with the technology that your children are using. I think a lot of people are kind of intimidated by the number of apps out there, and they evolve very quickly, and a lot of young people switch from app to app, and so just have dialogues about it, talk about it, understand what they derive from it, why they like it. Talk about what rules and values you want to set as a family. Do you want to set limits on what is okay to share? Are you okay with them posting pictures of everyone in your family? Some people use rules like only post something that you'd be okay with your grandma seeing or your teacher seeing or your future employer seeing. So have some conversations about those types of limit setting. For younger kids, it's often okay to try to rely on some of the monitoring technology. There are apps and ways that you can monitor usage, which could actually be helpful, especially if you are worried about the amount of time people are spending online. You can set limits, you can set timers, you can actually download things that do that. And also model your own healthy habits, because it's not going to, it's going to fall flat if you're setting limits for your young people but not following them yourself. And there are some resources which I'll post on here in a minute. And really just keep the dialogue going. These are just two key points that I would say. Again, healthy online lives rely on the same skills and values that you want people to use in their offline lives. And I think I already kind of covered all of that. So I'm going to leave you with a couple of resources. There's some good resources for parents, Common Sense Media, Connect Safely, several things that you can Google and find. There's also been, you probably, if you've been following the news, you've been seeing that there's a bit of a backlash happening. A lot of it came out of privacy concerns in general, but some of the technology companies are really starting to try to pay attention and put some more controls and safety in place. So they're starting to create parent centers, safety centers. There's a YouTube Kids app that is filtered, so it's only supposed to show safe content. So there's things that are being developed that you can try. And if it's an issue that you're passionate about and want to advocate for, there's a lot of people that are starting to look at using technology in healthy ways, like the Center for Humane Technology. There's a reverse hackathon happening in San Francisco in 2 weeks, which is all designed to try to find healthier ways to use tech to improve upon some of the products that we're currently using. So I'm going to stop there because there's a lot of other good speakers here, and I'll turn it over to Rochelle.
Right. Hello, everyone. I will not be using slides, so the rest of us here, I just want to prepare you that we will not be using slides. We just want to have a conversation with you and share like human beings in this space. So I wanted to take an opportunity to talk with you all just about some of the myths that we have around how young people transition in education and what are some of the things that we believe about what schools can do. What we know is that young people spend most of their waking hours with their teachers, their school administrators, the lunch staff, the janitor, the security guard, the groundskeeper, more so than they are at home. That is what we know about young people. And so a lot of the times, the people that know young people the best are the people at school in various capacities. And so one of the things I wanted to talk to you today about are a myth. So let's say, one of the myths that we believe are if children are having a hard time in school, they just need to work harder. I've heard that before. I've heard, parents talk to their young people about, why aren't you getting an A in math, for example? You need to work harder. You're not studying hard enough. And that's not necessarily the case. And I think some of us really know that deep down on the inside, and sometimes we don't always want to believe that's the case. And so the reality is young people are working really, really hard to be successful. And so sometimes they just need to learn a new skill, to identify, maybe they need to identify a new math skill that they need to work on. Maybe they are more concerned with social skills, and that's what's getting in the way of them being successful. And so there are a lot of things that young people are doing at school that they need to learn in order to be successful that are both academic and social skills. Another myth that we have is schools know what our children need, right? Because they're at school all the time. And schools are the expert on our young people. And that's not always necessarily the case. What we know is that there are a lot of young people at a school. And yes, schools do their best to make sure that they address every student's need. But in fact, we know that some students fall through the crack, right? Some of us have students in this room that maybe, should have been identified a long time ago and maybe weren't identified as the young person that maybe needed some additional services. So what can we do to make sure that our young people are being identified early on as needing support and giving them the support when they do need it? So we have red flags, right? So some of the red flags that we know identify a young person as maybe needing some additional support are behavior issues. And some behavior issues are, my kid talks too much in school. You need to stop talking. You need to pay attention. Some other behavior issues are you're always getting kicked out of class. You're always getting sent to the office. And we're always like, you gotta behave. You gotta sit in your seat. You gotta listen. You gotta pay attention. And sometimes there are other things going on with our young people that we need to inquire a little further and figure out, what is it about this class? What is it about what's happening for you that makes it so that you have to get kicked out of class all the time? We need to dig deeper and ask them some more questions versus kind of making demands about what they need to do, because they know what they need to do. They hear you say it all the time. They hear us say it all the time. We just need to dig a little bit deeper and figure out how we can investigate this some more. So those are some red flags, but then there are other flags. So suspension. When a young person gets suspended 1 time, 2 times, typically it's similar behavior. And again, we want to point to the young person and blame them. They need to get it together. But we also here in this situation should potentially look a little bit deeper and see how we can support this young person and figure out with school staff where they're doing things well, and maybe apply some of those positive behaviors to this other behavior to improve where they're struggling. Myth 3, you have to wait on the school to decide whether your child needs special educational services. Can I have a raise hand? Who believes that you have to wait on the school? Okay, all right, great, so that's good. We all know the answer to this question, but you do not need to wait on the school to identify your young person as someone who needs special education. And so all a parent has to do is send a letter to the school administration identifying what the issue is that they see that their child is struggling with, and that they do need their child to be evaluated for special education services. Schools have within 60 days to respond to a parent's request. So at that point, that starts the cycle of when a parent can start to figure out the special education services or an evaluation that a student might need at school. And myth 4, the last one, special education is only for children with obvious need. And so a lot of the times we think that a child's disability is obvious. Like, it's clear that this child has a disability. If you can't see it, then the child doesn't need it. And that's not necessarily the case. One of the learning disabilities that we know is invisible is dyslexia. A lot of young people go a very, very long time without learning to read because we can't see it. And they don't know that they're not supposed to see the way they're seeing. And so, again, checking in with our young people and figuring out, where are they having challenges and how we may best support them. And that is all I have. I know that you guys are all doing a really, really great job at being parents and providers and teachers and social workers and principals in the room. So this is not to say that you all aren't doing really great work, but it's just a reminder that for those of you who are doing really great work, there are some young people and some families that really don't know what their rights are and don't know how to navigate them, and it's important for us to share this information with those folks as well. Thank you.
Hi, everyone. I'm going to try to make my comments brief because my favorite part of this is actually the Q&A part. But just so to say that I'm a child psychiatrist, I'm a rare breed. There's just not enough of us out there. And part of the reason why I actually chose to be a child psychiatrist was this dream that if we were to intervene a little bit earlier, then could we somehow limit the amount of troubles that they run into later on in life? And after working 60 hours a week, I got to tell you, you're always constantly thinking about how to make things a little bit easier, how to intervene a little bit earlier. And that first brush with the school system actually happened while I was in training. I met these two high school students, and they wanted to have more mental health resources on campus, and they wanted to do a campus-wide survey. And I took that moment to sort of talk with them about setting up like another kind of survey, sort of asking, who, if you were given like a list of like the different resources at your school, the principal, the teacher, classmate, groundskeeper, et cetera, and psychiatrist, that was also included on there. And, how would you rank those different resources in your life? I was really sad to find that I was next to last. As like the most highly trained person is second to last. I beat out the suicide hotline though, so I take pride in that. But so to say that kids are not, they're just like you and me. They're not going to, spill out their life story to somebody they don't really know and who's, not very accessible. And so, one of the great things that I've really appreciated about working with the schools around here is this opportunity for the prevention, early intervention piece. I love working with schools that want to sort of peel this layer back because there's a lot of really good stuff that's considered low-hanging fruit. I don't want to get off on too far of a tangent, but there's this Romeo and Juliet book that all of your kids have read as freshmen or are going to read as freshmen. And, wouldn't it be great if we could actually teach the story as a series of missed opportunities to potentially even change the ending? Great way to sort of sneak that into the curriculum. But that's, yet another project that I'm looking forward to starting at some point. But so to say that there's a lot of, opportunities for early interventions and a lot of really cool stuff happening out there. The survey that I ran, that I didn't run, but the students ran and I helped them with, highlighted the importance of peers looking out for one another and just how important that is. We've done something like this before with, drunken driving and the idea of like the designated driver. You don't let people drive drunk, and now that's like just something that's de facto standard. People just expect that. And there was a lot of help with the media back in the 80s in sort of promoting this kind of pro-social watching out for one another. But I'm hopeful that, with the help of the community and the schools, we'll get the chance to sort of show, again, the power of the unity of our youth. They've already really, really inspired me in a way that I never thought I'd be able to see in my lifetime. And I think that if we don't get the chance to work more with the youth at the school before they come to my clinic, we'll miss this massive opportunity for them to be the better friend that I know they all want to be. And I know that you all want them to be. So there's a lot more about the school stuff, but I want to keep this short. So thank you.
I always want to clap after Steve talks. It's like, oh, my heart. Thank you. So my name is Inelia Souter, and I'm the Youth Outreach Specialist. And I get to talk to your hearts today in terms of the work that we're doing. But first, I really wanted to acknowledge the youth in the room, because there's no way, had I been 16, 17, a youth, and my mom said, hey, let's go to this talk at Stanford to hear about adolescent mental wellness, that I would be here. So much props to the moms that brought their children and to the children that actually said yes. So I definitely appreciate you guys being here, along with our youth that are here as well. And so I'm a little different in terms of my background. I'm a community worker through and through. I've been working with youth for the last 17 years, going on my 18th, woohoo. And it's really what I've learned in terms of it, and I'm really loving this work that I'm doing here with the Stanford Center, is that half of my time with, whether I was an outreach specialist, whether I was a case manager, whether I was doing programs in schools, whether I was doing community programs, half of my time was when speaking with the youth and building those relationships, seeing the need that, hey, we need to get you to some therapy. This isn't just a conversation that we could have. There's some other signs that I'm seeing that we need to get support. Half of my time was that. Half of my time was helping parents see their children behind those behavioral symptoms of stress. So being able to share with parents, like, hey, there's some actual needs here, versus you see what Rochelle was talking about. They're getting kicked out of class, they're talking too much, they're not paying attention, they're not doing their work, they're not connecting with you. And so being able to reach both is, I think, the strength of what we're trying to do with Headspace and including the youth. But that's what I kind of wanted to talk about, on how that's what I've been seeing. There's a general hope that exists, I think, with all parents, all teachers, is that we hope that the only issue that our youth are going through is that it's school. You know, my mom used to tell me, your job is school. You don't have to worry about nothing else. I'll make sure that you have food. I'll make sure that there's a house. Your job is school. But my youth here, my youth over there, and all of you who've gone through these systems, you understand that that's not the case. You know, sometimes, most of the times, they're also worried about you as parents. Are they okay? Are they stressed out? If I tell them what I'm going through, are they going to connect? I don't want to trip them out anymore. And so what happens is that with this general hope, we also know that there's a fear of judgment of sharing that kind of information as well, too, whether it's your parents because you don't want them to worry about you, whether it's your friends because you have this social appearance and this influence that you want to hold, whether it's violence that they're seeing now in the communities and that we've seen more and more. There's all these things that they're going through. So how do we support this? And so these are really easy lessons that I've learned. And as parents, you are the experts in having children and working with them. But you engage your youth by providing a space free of judgment and listen for their direction. And I think this is the biggest issue, because we have a lot of people in here that we're solution driven. I hear a problem, I want to solve it. You need food, I will find you a food bank. You need housing, I will connect with everybody in the community to make sure you have a place to stay. You want to talk to somebody, I will sit there and talk to you. But am I finding my solution? Am I finding my youth's solution? So that's a step back that we're asking parents to take in terms of being able to develop those kind of relationships where you step back, where you normalize help-seeking behaviors, where you acknowledge the difficulty of voicing something that is challenging. And sometimes, and my youth will feel me on this, sometimes these feelings don't have words. They're words that we can't, as youth, express yet. But in order to provide that youth voice, in order to support that, what we're doing is these candid discussions, and that's what we're asking you as parents, as teachers, to be able to follow through. So it's one of those things that most of my work and the progress that I made, and the awesome thing now that having worked for so long in the community, having a 17-year-old youth when I was 25, and now that youth is 32. One of my youth is 32. Trip out on that. But being able to support successful adults is what we're trying to do. I learned really early on, especially when I was doing this teen pregnancy program, we're not raising children, we're raising successful adults. And what are the things that we need in order to do that? And so the goal of meeting youth where they are, learning to listen, to guide, and to hear their voice validate and acknowledge is a reality, the common goal for all of us here. And so what we have seen, especially in youth engagement, and this is why the exciting work of what we're doing with Headspace and our youth is my job is to make sure that we validate that voice, that we validate that lived experience. And so one of the things to understand, especially with youth, and we've done this in our youth advisory group, is acknowledging that we are different with every kind of person. As a young woman, I talk to my mom differently than I talk to my partner, my boyfriend, my girlfriend, that I talk to my friends, that I talk to my teachers. There's all these different identities that we hold. And so the powerful thing about being able to support our youth advisory group is that we get all of those identities. We get all of those in terms of lived experiences. We validate those, and we see the youth as the expert in providing this feedback. And so what we've been able to do with the Headspace is that in November, we launched a very extensive outreach effort. We have received 52 applications. 33 youth went through a very extensive and rigorous interview process. And now we have 26 youth that have only met total 9 times, but for each of them, it's only 6. With IDEA, we've met over 17 times in terms of with one-on-ones, meeting out in the community, meeting in our youth advisory group meetings, but trying to get those feelings of when you walk into the space, what do you want it to feel like? When you want to talk to somebody about this kind of sadness, what do you want that to feel like? When you want to talk to somebody about your grades and that they're going to be in the mail and you know your mom is going to pick those up, where do you want to go? And so being able to have that is that the youth advisory board members are going to have a say in everything that we develop, from the way that place is going to look, to the feel, to the services, to the clinicians that we're going to have, and they're going to be able to provide all of that. What I believe is that not only are we asking for their expert advice and opinion because they're the youth experts, but we also want to provide a space for them to share. They're also going through a lot of the things that your youth are going through. And so being able to provide that is really going to help our center really be a space where youth can come in and get support. And now, if we can have my youth advisory group members come and join us. So what we've thought is, what better way for you to get access to adult mental wellness? Dr. Steves, because there's 2 of them, will provide you with as much information as you want. We have really great staff, but we feel that the youth really are going to give us more of a glimpse as parents, what you're looking for to hear in terms of your youth. So I asked each of our 3 youth to answer 3 questions: name, school affiliation, age, so you know where they're at. And my first question to lead us off is going to be, in terms of communication, what would you have wanted your parents to know, right? Okay, so, and right now this is also audience participation, so if you guys have those index cards, please feel free to write some questions, whether it's to our youth, whether to, Rochelle will be picking them up, whether it's to our staff. Please feel free, this is a very interactive process. All right, so why don't we start off with my left, because we know that's a rule. Citla, you want to come up or get us a mic?
Okay, hello, I'm Citla Jimenez, I'm 22. I'm a SF State graduate with a BA in Psychology, minor in Sexuality Studies. I'm currently working for Citizen Schools in San Jose at the Shepherd campus. And I joined the YAG because growing up, like, I struggled a lot with my mental health. I'm your typical wounded healer. Like, I struggled through it, and now I want to help youth so that they don't have to struggle through the same things I went through. And joining this YAG was a great opportunity for me to do this. I kind of just saw it and I took it, and I hope that I can really make a change for youth in the future. So just answer it.
Yeah, answer those two, and then we'll go back to the question.
Okay. I think what parents can do to kind of like strengthen their communication with their kids is kind of just listening. One of the big things is listening without judgment. A lot of times it's easy for parents to listen, yeah, but at the same time they're also saying like, well, what do you have to worry about? Like, you're just a kid. And I even hear that, or where I work, where there's these middle school kids talking about how they're so stressed out about life, and the teachers are saying, well, you're just in middle school, like, you're just starting, what do you have to worry about? And the thing is, like, at this point, like, youth, their brains aren't developed all the way. They don't understand that the pain they're feeling right now isn't permanent. It's gonna eventually go away, but it's also gonna go away if they get the help that they need. So if you just negate that and just make it seem like what they're going through is so trivial, they're gonna see that, oh, well, if everyone else is doing okay and I'm struggling, like, what's wrong with me? And what am I gonna do to make myself feel better? And they're not gonna reach out to you if they feel like they can't even come to their own parents. So I think a big thing is just listen and don't judge, and, you know, give them the support that they need. So.
Hi, I'm Phoebe Cox, and I'm a sophomore at Gunn High School. I'm 16 years old, and I've been really fortunate, I'd like to say, for my family, because I grew up in a household where my mom was a psychiatrist and my stepdad was a psychiatrist. So mental health really wasn't something that was super foreign growing up. But it didn't really hit me until freshman year of high school, especially at Gunn with all of the suicide problems that we've had. And I really think seeing my friends deal with issues like depression and anxiety like really changed the way I viewed it and the way that I felt about it, I think. And I think that parents can really, like what you were saying, realize that although it might seem minor to them, it's really not. For, let's say, a middle schooler or a high schooler, these things, although they might not mean anything in 10 years, it changes the person you are, and it changes the way you deal with relationships and interactions and social experiences, and it can really traumatize people, like in high school and middle school, and those things will carry all the way throughout your adulthood. And I really think it's about, like creating an adulthood for somebody where they can actually support others in the future and not have it be so negative and not have it be such a bad thing to talk about, because I really think every kid should be able to know what depression is at the age of 5 and be able to say, like, yeah, it's just like breaking your arm. It's not something that you did wrong. It's not something that you can just snap out of or just don't deal with it, like you're fine. It's not like that. It's really something that I think parents can help with. So, yeah.
Thank you.
Hi everyone, I'm Casey. Casey on full name, right? I'm 25 years old, and I currently work in tech at Chegg. I grew up in San Jose, so for me this is home, Bay Area. I went to UCLA, graduated in poli-sci and communications, and moved back to work in tech 3 or 4 years ago, which is wild. So for me, I wanted to join YAG because my lived experience was a bit different maybe than others. A couple years ago, my mom went through a very depressed state where she was an empty nester, and she was really like, what do I do with my life without you guys? Like, I really need you. She attempted suicide, and for us, it was a big wake-up call of like, well, this is something that we should all be really talking about. And I think for me, in the Asian culture, I'm first-generation American, so there's a huge stigma, and like, I don't want to talk about it. I'm not crazy. And so for me, YAG was a great opportunity to get involved early on, to really be like, we should talk about this in the community where, you know, it's okay. So, like, just like you broke your arm, just like you sprained your ankle, like, I'm depressed or I'm feeling this way and that way, and that's fine. So for me, with parents, I wish my mom and my parents talked about it more. I wish they talked about their feelings and they were really candid about it. Like, they don't have to hide the fact that they're stressed or, you know, they're tired or they're going through this and that. Like, I think with kids, they realize more than not that you're also human. And it's okay to show that that's your feeling right now. So, I mean, that's kind of my story and why I'm really passionate about youth mental health. And I think there's a lot we can do, especially in the Bay Area, given that there's a lot going on here with everything from being an adult to trying to find a job to graduating or going to college or going to the right college. There's just a lot going on.
So I think we can open it up. I have a couple questions for my youth and for our staff. If any of you have questions?
Right, I think we want, if people,
Yes.
this is a good time to start writing down questions and then we can start collecting them.
Sure.
If people have any they want to particularly ask.
Awesome.
And then,
So one of the questions that I have for you ladies, thinking back to high school, for those of you that are still in high school, thinking of school right now, what is the key insights that you three can offer to parents about talking with their teens about the issues that they're hearing about that are going on at school? Like, how would you say, like, if I was your mom, Casey, and I heard that something happened at school, how would you want me to ask? You know, would you be like, Casey, darling, I need to ask you a question? Or how would you as a youth have taken any kind of, you know, communication from your mom about stuff?
Yeah. I guess I could start.
Because you have the money.
Yeah. So I think thinking back to my experiences, I always felt like I knew when she was coming to talk to me about something important. Like, it was like a, hey, do you have a second? It was always like, and it kind of just set the tone of like, okay, like, I don't want to talk about it, right? Because I know you're going to ask me something serious I don't want to answer. And like, I don't feel comfortable answering it. How would I want her to address it? Oh man, I don't know. I feel like it goes back, it's just kind of like for me, I wish my mom talked about her experiences as much as she wanted to know about mine. I feel like she was always prying about like, how's school, like, how's dance, how's this, how's that, and it's like, it's great, it's fine. Like, but she never told me like, oh, at work, like, we're really stressed right now, or like, oh, you know, I went to hang out with my friends and we talked about this and, you know, what they're working on or what they're traveling to. I think now she's making more of an effort to really talk about things that she plans on doing herself, which I think helps the relationship because it's not so much like, how are you feeling? What are you doing? Like, constantly, it felt like she was, you know, questioning me 24/7. And, yeah.
Nice. Any of you want to answer that question?
I think don't minimize the problems, because if your kid comes up to you, that's a really big deal, because I know like more than half my friends will not go to their parents because they already have a set mindset about what the reaction's going to be. It's going to be bad, they're going to judge me, they're going to treat me differently, and it's amazing if they come to you and want to talk, because I know from my experiences is that they always want to talk about something. They've always got something on their mind, but if you ask them in a direct way, they're not going to want to tell you, which does make it more difficult to approach the question. And I think, yeah, comparing your childhood to your child's childhood is way, like, it's not good at all. Yeah, I know my mom grew up she was first generation American, and her family was very strict about its school and then home, and that's it. And so anytime my mom would compare my life to her life, she'd say, oh, well, you're lucky you can have a friend over, because when I was your age, and that turns the conversation off, nothing's gonna get resolved at all. And there are so many more issues that kids are dealing with these days, especially with social media, and I think, kids have to grow up way quicker in this atmosphere, and the demand has increased dramatically, I know for a fact, especially in Silicon Valley. And I think parents should totally be aware of the things kids are dealing with right now, and just open your eyes and be more aware and less demanding and comparing, and just realize your kid's an individual, and even not doing anything and just saying, hey, do you want to go get ice cream? Like that can be enough.
Thank you, Phoebe.
I think maybe just when coming about talking about an issue, come in with an open mind and kind of don't be upset if you don't get the response that you want. I know that would happen a lot with my mom. She would come in and kind of how Casey said, like, hey, like, how's it going? Like, do you want to talk about this? And I would be like, no. And then she would get angry. And I'd be like, well, why don't you want to tell me? Like, you know, I'm here to talk to you. And, you know, if you come in with, even if you don't get the answer that you want, just if you say, like, well, when you want to talk about it, like, I'm here to talk about it. And don't forget that. Coming at it in that sense instead of being angry and turning it into a fight. Then that would be a better way of getting some sort of communication started. So.
Thank you, Sis Abby. Why don't we, are we going to take some of those questions?
Sure. Before I do, I just want to thank you guys. You're really wise, and we're really lucky you're here. And you know, I think I just want to echo some of your comments because you know there have been times when I sort of get asked similar questions, and particularly as it relates to issues of stigma. And you know, one of the things that that we also talk about sometimes, you know, particularly with families in this community, and I will share with you that I'm the father of 4 girls. My youngest is, I think pretty much today finished her junior year at Gunn High School. And I think one of the things that I would say that I think is very important is, you know, we also, you know, as a parent trying to not put too much pressure on my child and let her know, you know, and let all my kids know that, you know, I love them no matter what. And but I think to one of the points that was also made is that it's one thing to say, you know, we love you no matter what, and you don't have to be perfect in everything that you do. But, you know, I think like for my daughter that has this dad that's this child psychiatrist at Stanford and a mom who works at the law school at Stanford and has this idea of, yeah, whatever I do is fine, but like, you know, aren't I supposed to be just like you, really? And aren't I supposed to work here just like you? And so I think part of what also becomes important is, you know, the conversations that we have about, like, all the times I've screwed up, and all of the things I've done wrong, and all the things that have embarrassed me, and all the times when I got depressed, and when I really struggled with stuff with my parents and my own family. And I think to your point, really being a human being with, you know, with our kids, so that as much as the message is, you know, you don't have to be perfect, and look at all the times we have not been perfect too. And really being human with our own children in that way becomes very important, I think, in giving like my daughters permission to sort of be who they are and to explore on their own and to give them space to try and to fail and to fail and to fail until they figure out sort of their course. And so I just think it's a really important part of what these young people are also sharing with us that I think as parents, it's sometimes very hard for us to do, but I think it's a really important thing for us to keep in mind. So I just was thinking about that in relation to some of the things that you guys were sharing, and wanted to thank you for that as well. I want to answer a couple of the questions that have come up so far. One of them was, are there pediatricians for teens or general practitioners at our center? And unfortunately, we don't have specific primary care clinicians that are working at our center. We partner with some though. And one of the questions was, you know, where do we find other primary care people that focus on physical and mental health? So for example, as we are looking at creating these integrated mental health spaces like this Headspace program, as we're looking at putting one of these sites in the north part of Santa Clara County, one of the partners we're really hoping to work with is our own adolescent medicine clinical team here at Lucille Packard in Stanford. They do a lot of work around eating disorders, but they also have general adolescent health clinics. And so they are a good place to check out within even the primary care clinics in both internal medicine and family medicine that have started within our system as well. There are many clinicians that are really interested in adolescents and young adults too. So those are the ones that we're sort of working with, as well as people at some of the federally qualified health centers in the community. We're looking at our site in San Jose, having actually some of the primary care specialists from the county as the other primary care partner that we'll be working with as well. So that's just a couple of suggestions of the people that we're sort of partnering with on the primary care side. One of the other questions that I'm going to give a try at is, how would you approach another parent if you see red flags in their child that the parent seems to be missing? And again, I think about this as a parent, but part of the problem is I'm a child psychiatrist, right? So when I go to the other parent and say, I'm concerned about your child, it's sort of, it's a little bit of a weirder conversation than it might be if some of you, had that conversation. I think part of the issue, I think sometimes is I think being able to have the conversation initially in a way that, in order to do it in a non-stigmatizing way, because I think one of the issues that I think that causes so much stigma around dealing with mental health issues is there's this sense that really is common in our communities, which is, what's the matter with that child? What did that parent do wrong that their child is having this issue? And it must be something about how they were raised wrong or something that, that they did. And we don't give a lot of room for this notion of neurobiological illness. We don't give a lot of room for sort of the health and mental health aspects of having mental health conditions. We don't give a lot of room as it relates to trauma and issues related to that as well. And so I think in having those conversations, what might be important is for one even to first acknowledge that, as we were saying before, I know this has been an issue that either we've been dealing with within my family or that I've been dealing with, or finding some way to normalize the issue even right up front, so the parent's not feeling like they've done something wrong right as you start talking to them about the concerns you have. And I think there are also ways that we can have these conversations that come out of a place of love and concern for other kids and families, and there are ways to get that message across. And with that, one can raise a question in a wondering and supportive way, and being very clear that there's no intent in terms of a blame, but really whether it's your child has noticed this or having their child at their home sort of leaves you wanting to be sure that everybody's doing okay. It also raises for me one of these other questions where, I think with at least 3 of my 4 daughters, I've had to call parents, at 11, 12, or 1 in the morning and tell them about, the text messages from their child to my child about, whether or not their child might be thinking of harming themselves or killing themselves. And, and so the conversations I've had at home have really, been with our own children around, having a low threshold for coming to us when they're worried about something their friends are telling them around this. And then at the same time when they've had to do that, for our kids it's really been a struggle because they're worried about what's going to happen with their friend if their friend knows that they've told us and we're going to tell the parents. And these struggles around, would you violate your friend's confidentiality to save their life? And having those conversations up front sometimes seems really important. And then, what I would say is that there have been some times where we've done those calls, either my wife or I, and some have gone much better than others. And, sometimes it's you know, my daughter's right here next to me in the room, she seems totally fine, I'm not sure why you're bothering us. Everything's really okay, thank you very much for your concern, goodbye. And you know, sometimes they've been very different conversations around when, you know, these are things, you know, we've been worried about her, and I'm glad she's talking to your daughter. And, you know, and sometimes then asking me, because they know that, I mean, what do you suggest we do? Where do you think we should go? And then being able to have a different kind of conversation. But I think there are ways to have these conversations that can happen in a form of supporting you know, how normal it is that our kids are struggling with these issues, having these conversations in a very supportive and kind way, and doing it in a way that, you know, you're ensuring, you know, that these families don't feel blamed, or that they've done something that they shouldn't have done, or causing something bad. But really it's out of concern, and that you know that, you know, the young person will get better if they actually get the support that they need. Okay. I don't know, Debbie, do you want to speak to any of these questions?
No, I was going to ask more. Okay. We have a couple more questions from the audience, and this is for the youth. And there's one that is kind of the same, so I'm just going to read one out. What are the kind of issues that make you feel stressed or depressed? And another way of saying that would be, what are the big things that are stressing you out these days? Get it, Phoebe.
There's a long list. I think I was really anxious as a kid, and I didn't really know what anxious meant until I started kind of thinking about it a little more, maybe 8th or 9th grade. And it was like, I didn't want to go out of the house because I was scared I'd see someone I knew, and then what if they tried to talk to me, just like little elementary school stuff. And that stuff really followed me throughout high school. I still have social anxiety going into like big group events and stuff. So there's social anxiety, and then there's also stress with school because apparently a B is failing, so that's pretty like intense, I think. And most of my friends have GPAs like above a 4.0, and that's expected, and it's scary that that's what people are shooting for. And I've seen people literally like tear their lives apart trying to get to that like goal, and when they get there, nothing's changed. They're still unhappy. And yeah, I tried to achieve that, and I had a really hard time reaching that, and it didn't fulfill me at all. And trying to find meaning and sense in a world that your parents are telling you that just focus on school, it's okay, and you're still trying to find your individual identities, it's really tough. And then I've also got friends going through a lot of problems. I have a friend, his parents are getting divorced, and that's really intense, realizing that your parents aren't invincible and they have problems too. That's something that really, I think, affects a kid, and it hits you pretty suddenly, the fact that not everyone that you've grown up with is perfect, and you're not the only one that has problems. And I think definitely talking to your kids and making sure they know you're human too, that they can't just yell at you and like expect you to just bounce back, that it takes a toll on you too. And just kind of trying to help that power differential, and don't be condescending towards your kid, because otherwise they're never going to see you as a person they can talk to ever. It won't be equal. So yeah, family, school, friends, all of that, future.
Thank you, Phoebe.
I think she touched on everything I was going to say. I feel like I'm stressed about different things now than I was when I was in high school and even college. I mean, when I was in high school, it was all about like getting into a really good college and where are you going to go and where are you going to take your life, like which way you're going. And it was all about grades, getting good grades, but also doing extracurricular activities so that you stand out, starting clubs, joining sports, like doing all these things to get into a good college. And then once you're in college, it's all about surviving. And a lot of people drop out their first year because they go in not knowing what to expect. So like, then once I was in college, it was just about like staying in there, getting good grades there. And then now that I'm out, it's lonely because, I mean, a lot of times you lose a lot of resources when you leave college. You come into the workforce and it's about where you're gonna work. And you, like, for me, I was living in San Francisco, and when I moved back home, all my high school friends, like, I hadn't really reconnected with them in like 4 years. But then all my current friends were back in San Francisco, which isn't that far, but still, if I'm working here, like, I can't go back every day. So kind of changing from being a student my whole life to suddenly, like, working, that's a huge change. And it all kind of ties together because at the same time, there's also family things going on, like relationships with my mom or, you know, people getting sick in the family. You know, also being a good role model for my siblings. So it's all these things going on all at once that sometimes you feel like you can't take a moment to take a breath because if you do, you're going to fall behind. So, yeah.
Let's do another question. This is a great question. Great question. You've given some great examples of what not to do or say and how not to ask. Can you give any ideas or examples of how we, and I'm assuming we as parents, can learn what a teen's life is like in 2018 if asking directly is off the table? Great question. Do you want to take it? Go for it.
Yeah, that's a hard question. I know that there's definitely a weird change and shift in the dynamic between a parent and a kid, especially when you reach adolescent stages of life. I think it hit me when I was more like 8th and 9th grade, and I've always had kind of a close connection with my family. My parents, it was easy for me to talk to them. But then starting school like I've done, and then all of the changes in friend dynamics, and just realizing that my parents couldn't keep up with my social life, where like my friend would do something mean to me and I wasn't friends with them anymore, but then they'd ask me about it, and it just like kind of freshened the wound more of like whatever fight I had, and it just made everything worse. And I think just don't do it. Wait, that's a don't do it. Don't. What to do? Be more of an equal to your kid, and I know that's not necessarily the best way to approach every situation. You can't be an equal to your kid because that's just not how it works, but trying to put it in a way that you don't know everything, you're not superior to them in all ways, other than the fact that you can provide a house and food and resources. Not relevant to this. Just try and make sure they realize that you're not trying to be condescending by asking, and that they maybe don't need help, just talk. Does that make sense? Yeah, just try not to condescend and try not to fix the problem. Just listen to the problem, because there's definitely an issue in mostly Silicon Valley. I think it's like immediate satisfaction and gratification, and that's just not something that you can do when it comes to relationships. It's not something that, oh, it's gonna fix. You're gonna build this connection with this person, like just like that, and things change really quickly. So I think just being able to support them throughout the issue and not try to resolve it or come up with a solution. So.
We have a clarifying question, so I'm going to pass the mic to someone in the audience really quick.
So I have heard and read that sometimes if you want to get sort of a snapshot of what's going on with your own child. So I'm wondering if this sounds like it would be reasonable to you to ask your child about their friends, not necessarily how are you doing, but you know, how's, you know, get a feel for how their social group is doing, or you know, ask a question about a friend that you know that I'm aware of that was struggling with something or broke up with their boyfriend, and then that might prompt you to then share your own experience.
I don't know, does that I think that bringing up specific individuals is not necessarily the way to go. I found it's easier to do a really open-ended prompt, like,
We can tell your child of psychiatrist.
yeah, my mom's over there. Yeah, everyone look at her, please. Prompting, I think an interesting way to do it is like just every day ask like for a bud, a thorn, and a rose.
A rose.
Yeah, and
Very cool.
it sounds confusing. A bud is something that
You're working.
you're working towards or you're excited about, and it kind of promotes the idea of like looking forward as opposed to being stuck in the moment, because that's sometimes hard to just see that every day you're going forward and you're going to go somewhere, and it doesn't have to, this is not a defining moment for you, that there are things you can work for but you won't achieve right away. And a thorn is something that maybe sucked that day or just didn't go as planned, but it doesn't necessarily mean it's gonna completely cut the whole rose off. It's just something that maybe got in your way. And then a rose is the highlight of your day or something. And I think that's a interesting way to kind of approach it, because then that'll get them to start talking about, oh yeah, and then today, like, so-and-so came over to me during lunch and we had a conversation and we reconnected or whatever, or like, oh, during class, like, yeah. So I think a great way to cut the conversation off is to ask about a specific person, or how's the friend dynamic going? That's, no kid feels comfortable talking about, well, this girl shut me out of the group today, or oh, they're not talking to me for some reason, or oh, my boyfriend broke up with me. It's not necessarily something that you're gonna just jump right into. So.
Do you want to add to?
I was just gonna say, like, it also depends on your child. I could come up here and tell you all about, you know, what works with me, but the first step is kind of communicating with your child to see, like, oh, well, you know, what's not working here? Like, what do you think I need to work on? And maybe, like, talk to them in that way first. Because if you just suddenly change your dynamic, that's also gonna throw them off. And they're gonna be like, whoa, like, what's going on? Like, what are you trying to do? So, I mean, maybe, like, kind of trying to understand where, like, the kind of kids you have. Because for me, at least, like, for me, I would rather have someone be more direct and, like, ask me, like, okay, like, so I want to talk to you about this. But for someone else, that might be too intimidating. So I think it's all about, like, working with, like, what you have at home.
We've got some.
Yeah, I have some, but.
Yeah, answer some of them.
Really?
Yeah.
Yes. I wanted to say one thing as a person who's been put in the mediator role with, you know, I would be the one building the relationships with the students, and then parents would ask me that question. Like, why does she talk to you but she doesn't talk to me? How can I do that? And so there's a couple of things that I've learned that I would tell parents, and one of them is build a relationship. You know, again, every opportunity is an opportunity to connect. Most of the work that I really didn't happen in my work groups. It didn't happen in my one-on-ones. They happened on the drives to someplace. They happened on the, hey, I haven't eaten today. Casey, come with me. Let's go grab a burger because my mom said if I'm going to eat, I have to buy something for somebody else. And those conversations happened. So they weren't so poignant. They weren't so direct. but they kind of happen on the sideways. And so building those relationships open it up, in terms of being able to connect. That's what I want to
Oh,
say.
wait, real quick. And, I mean, Anna and I both work with all of the young people that we work with, and one of the things that I realized is, I don't realize when I'm connecting with a young person. Like, I never get it. I'm like, how did this all of a sudden happen? Like, why are they telling me all this information? And it's because I ask questions like, so what are you gonna do? And they have to tell me. I have no advice for you. I want you to tell me what you're gonna do. Well, did you ask them? Like, what do they think? Do you think it's gonna work? And let them figure out how to solve whatever it is that problem is for them, because they do have the answers. And sometimes we give advice, and the advice is really, really bad. But they have the information in themselves. We just have to kind of reel it out. And so when we just kind of, fish around a little bit, see what's going on in their head, they're usually willing to give you information. And then all of a sudden you get stuff and you're like, okay, that's enough, I'm good.
Take it away, Steve.
All right, I actually wanted to hear more from the youth, so sorry. One of my questions was, how can we differentiate between normal teenage behavior versus depression, versus anxiety, versus ADD? And I think this reminds me of a question a friend of mine had about her 10-year-old kid. He came home from school one day, and she noticed he was just more withdrawn, not quite as interactive. And, she sort of talked about the mommy spider sense that you get when something's up with your kid. And I know for you parents, you know exactly what I'm talking about. You've known your kids their entire lives. And part of it is not only paying attention to the very frank shift in your kids sometimes, but also having a low threshold to sort of talk it over as mom and dad together. And then at some point, if noticing that this change is sustained for a period of time. I don't want to get into DSM-5 diagnostic criteria, but quite frankly, parents are obviously paying attention to their kids. And if you are starting to get concerned for a sustained period of time, and it's even starting to affect some of the basics of of their lives, they're not taking care of themselves as much, or they're more irritable, and it's for a sustained period of time, I would argue it's probably a good time to start checking out some more sources of information. Hopefully you've also nurtured some kind of relationship with your child's friends, maybe their parents, and just trying to gather a little bit more information, if at all possible. I think the other good place to potentially check in on is just trying to talk to them, and just maybe even considering trying to create an open space to have that conversation if your child is feeling comfortable enough to do that. And more often than not, as they've mentioned, it's not. And that's okay. Sometimes it requires a little bit of time, walking together or driving somewhere together. And that's kind of when you can start to have the beginning of that conversation. And it might not be anything in the way of a major depressive disorder, general anxiety disorder per se, but the simple fact that you noticed it, and you noticed it early on, I think is a great place to start the conversation. And if it's not getting any better, I would argue that deep down your child doesn't want to suffer for that long either. And this is a great time to sort of bring it up as mom and dad together and trying to take a more supportive stance and just trying to figure out how to help them. Deep down, you and your child want them to self-actualize. Sorry, that's from Abraham Maslow. He has this hierarchy of needs thing, and the self-actualization is when you want to reach your superstar potential internally, and you want to help your kids reach that superstar potential. So if we're all sort of on the same page in terms of kid wanting to be a superstar and you wanting your kid to be a superstar, why don't we try to figure out together what's going on here? So the short of it is that sustained period of time where you start to notice the difference and it's starting to get in the way of their daily functioning. I think that's kind of when you need to start wondering what's going on. Do I need to talk with a school counselor? Do I need to just check in? I don't know, but you definitely should try to talk a little bit more and try to get more information. Trust your instincts as parents. sometimes your kids might not be able to talk about it. And part of it is just trying to create the open space and trying to open the conversation, if at all possible.
So that was good. I'm actually going to piggyback on that with another question because the answer is sort of the same as what you just said, and then I'm going to throw one to the youth. So one of the questions was, how can parents tell when social media is a problem, and what are some ways teens may respond or self-regulate? So I think how to tell if it's a problem, I think, goes to what Dr. Suss just said. If trust your instincts, there's a reason that you're wondering if it's a problem, so you're obviously probably picking up on behavior change. You only want to worry if they're not taking care of themselves, it's affecting sleep, eating, that's when you want to start to worry. Or if there's something that you are concerned about, dialogue, talk about it. Don't just like be an observer. You're just like you would be concerned if they weren't eating properly. You just want to be involved. It's just part of the conversation. And I'm going to ask one of the other questions, and then you can respond maybe to either of those. So each of you has had a bad social media experience at some point or another, most likely. Bullying, body image shaming, feeling depressed after looking around. What tools did you use, or what can we suggest to our team to limit how deeply they are affected by these experiences? Anyone?
There you go. So yes, definitely have had those experiences before in the past. I think for me what helped a lot was just knowing that there was someone to go to. I was lucky enough to have a really strong dance community. So there's a lot of people that weren't my parents, that weren't my family, that weren't necessarily adults, but people that I trusted, that I knew I could talk to and like be really honest and like sob and cry and just really be emotional with them. So I think sometimes it's not just you need to be the resource for them, it's just realizing they might have really good friends out there that will have their back and they can talk to, and that's fine. It doesn't always have to be you.
Thank you.
Yeah. Again, like I play soccer, so I've had a really strong bond with my team, and I've had some amazing coaches that I've been able to get support from. And I think, yeah, there are ways that parents can support, but then there are also ways that other people in the community can support. And I think having those resources from a young age and forward, like extracurriculars are definitely something that is really important for a developing kid. And yeah, I think I've had the problem of like obsessively looking at like someone's story or seeing other people hang out without me, and I think what really helped was just putting my phone down and living in the moment and living my life right there, because although people might be doing other things elsewhere, it doesn't necessarily mean they're having more fun than me, or it's just an appearance, it's not reality. So.
Thinking back on like one specific event that happened at my high school, there was an Instagram page that was made that basically attacked all the girls in my year. I think it was my senior year in high school. And I was part of that, like posted on that page. So I know what helped through that situation was that all the girls who had been attacked on the page, we kind of like rallied together. And we went and talked to the principal, and they ended up figuring out who it was. And there were like, they did take action. I don't know if they were expelled or something, but at least with us, the girls who were attacked on the page, we had guidance counselors and psychologists that talked to us, because there were a lot of hurtful things that were said on there, and also people adding to it in the comments. So we had a meeting with us, and then we also had like a school-wide anti-bullying kind of like rally too, to talk about like the incident. And I think honestly, like just the fact that the school had that for us, because I know some schools would have just been like, oh, like that's not our problem, that's like on social media, or the principal probably just would have expelled the person and just left it at that. But the fact that my school kind of took that extra step to like talk to us and like see what we were going through, like that helped. And I know for me, my best friend was the person who helped me through that situation, because I know I felt really like hurt, and it affected my self-esteem like pretty bad. But my group of friends were very supportive, and I think honestly, like, when it comes to that situation, the person you go to is your best friend. Unless it's your best friend, which that can happen, who is attacking you. Then it kind of just depends on whatever other support system you have. But for me, it was my best friend.
I think that's all we have time for, and I just want to thank our youth panel especially